Hello, my dearest friends. It's Tanya again from your Fertility Counselor podcast show. I'm back again today and I'm looking forward so much to my guest today. I have Dr. Lily Ko-Chai Lee from the Alpha IVF Center in Singapore coming on my show today. She is an OB-GYN, but also a fertility specialist with a special interest in women's health as well as in fertility. And she has so much experience with PCOS as well endometriosis. So I'm so curious and can't wait to actually get started to embark on a really deep conversation about her experience and her knowledge and wisdom. So make yourself ready and comfortable and let's start. Hello, everyone, and welcome to today's show. I'm so excited to have Dr. Lily Ko here from the Alpha IVF Center in Singapore. Hi, Dr. Lily.
Hi, Tanya. How are you?
I'm good. How are you?
I'm good, thank you. Doing very well.
I'm so excited to have you here, Dr. Lily, today because I can't wait to have this conversation with you about fertility and how you help all the women and couples in Singapore and dive deeper into our conversation, really.
Thanks for having me, Tanya. I appreciate that. It's really nice to talk to you too.
So I was wondering before we actually kick off with the questions around fertility, I was wondering in your morning ritual, when you get up and you get ready for your day, is there anything specifically that you do each and every morning that you feel like, when I do that, it just sets me into the right tone for the day?
Yeah. No, what I love to do in the morning, the first thing when I wake up, I love to clear my head. So
Mm.
I do mindfulness activities. So my mindfulness activities is not yoga or anything, but it involves some physical activity. So I love swimming. I love being just in the water for at least half an hour to 45 minutes, and it's totally undisturbed. I'm just in my zone and I'm just enjoying the water. I'm just enjoying the weather and all that. So that's what I really, really love. Sometimes I go to the gym as well when I want a little bit more adrenaline. So I do my weights and stuff, but that is essentially mindfulness for me. Then after that, I go home and I have more mindfulness with my daughter.
Wow.
She's 2 years old now, so we normally have breakfast together, we have a little conversation together, and that sets me up for my day. Then I head off to work.
Oh, wonderful. I can only imagine how peaceful this must be to get into the water in the morning. It's such a
Yeah,
great way to start your day, isn't
yeah.
it?
Totally love it.
Oh,
You see the sunrise. I mean, I
oh,
wake up quite early before 7, so you
yeah.
actually see the transition to sunrise is really beautiful.
Oh,
Yeah,
amazing, amazing. You are taking me to a completely different world right now, but let's go back into now, the present, right? Which is mindful as well. Yeah. So I was wondering, for our listeners that may not know you yet, Dr. Lily, could you maybe introduce yourself and share a little bit about your journey and how you got into the field where you are working now?
Mm. So actually, since I was a very young girl, I've always enjoyed charity. My parents were very fond of charity. So even as young kids, they would advise us to set away some food or set away some clothes or donate money to charitable organizations. So I really enjoyed doing that. But one of the things that I wished I could do more as a young girl was that I wanted to be more involved in helping people.
Mm.
So instead of just, giving money or giving objects, I felt that maybe I could do more by being more personable. So that's why I wanted to become a doctor.
Wow.
Yeah, so to which my parents strongly objected because they felt that it was a very long kind of career prospect and I wouldn't have much time for myself. So my dad he had an oil and gas company. So the joke was he used to tell me, Lily, why don't you do ONG? So I said, yeah, I want to do ONG. I love ONG, obstetrics and gynecology. He says,
Mhm.
no, 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 not obstetrics and gynae, but oil and gas.
Oh,
So I said, no, I don't want to do oil and gas. I don't want to make money from people. Like, I really want to help people. And he says, oh, you're going to regret your decision. Long working hours, you get called for delivery at random times of the night. I said, no, I would love it. So I went through med school. They eventually agreed to put me through med school. So I went through medical school. I studied in Australia, actually.
Oh.
So I was there for about 7 years, 1 year foundation, 6 years in university. And after I graduated in 2009, I decided to come back to Singapore to work. And that was how I started my ONG training. And I really, really love it. I really enjoy it till this day. Yeah, it's a really nice mix of medical, surgical. There's a lot of ups, but as my career progressed, I realized that there's a lot of downs as well.
Mm,
So you see patients go through very difficult times in their life, but it's really sad. And
mm,
sometimes when you put yourself in their shoes, you actually really feel for them as well. But
mm,
I put a lot of emphasis in bringing and trying to encourage them and helping them recover and being with them through that journey. And even though there's some downs, at the end of the day, it always improves and they always have a good outcome.
mm.
So yeah, so but I love it. I love ONG. I mean, I tell people if I didn't do ONG, I don't know what I'll do with my life.
Oh, so it means that you are in the right field.
Yeah.
Absolutely.
Yeah, I really
And
love it. Yeah.
what actually took you then, because you now became also fertility specialist
Mm.
and specifically in women's health. So what took you then further into fertility?
Mm. So I actually, being in a general ONG initially, we really spend a lot of time with patients who obviously come in being pregnant already. But we also have our fair share of patients who are infertile or subfertile, patients that we try our best to get them pregnant. And I often wish I wanted to do more for them, just not helping them through that journey of infertility, going through the early pregnancy and the pregnancy itself. It's something that if you start earlier, you kind of understand the patient earlier, and that journey with them is really very precious. So now to this point, when they come in and see me for IVF, I get them pregnant, and now when we go through the early parts of pregnancy, actually me and the patients treasure it more.
Mm,
We feel like, wow, we've journeyed through this
mm.
together. This is kind of a fruit of our labor together. It's what we've done as a team to achieve this outcome. So it makes it even more meaningful, actually.
Yes, I completely understand. Yes, we have been there as well through counseling as well when we see like patients trying it again and again and again through fertility treatments to
Yeah.
get pregnant, and then ultimately they come and visit us with their baby. And this is just such a magic moment for us.
Yeah,
Each time it
exactly.
gives me so much goosebumps. Yes.
Yes, yes, yeah. That's how you feel, right?
Yes,
Yeah, yeah.
yes, it's wonderful. Since you mentioned actually about that the journey that comes before pregnancy, are you seeing, I'm curious to hear from you, are you seeing differences between those that have been trying for longer to get pregnant versus those that actually became pregnant quite quickly, and then how their pregnancy evolves as well as postpartum?
Yeah, so sometimes there's a difference.
Hmm.
Obviously, when most patients who get pregnant easily, they tend to be of the younger age group as well.
Ah,
So, being younger, they also tend to have less problems or, medical issues. So naturally, you see the pregnancy progresses very, very smoothly in most cases.
mm,
They don't have much stresses. They don't have any previous past, history that have made increased their levels of stress.
mm,
Conversely, if you have a patient who's come in and they've had a more difficult journey in conceiving, they've
mm,
naturally either had, fertility treatments in the past, or they may have like medical conditions that had made them, have that difficulty in terms of conceiving. So they come with a lot more stress, to be honest with you. And there's a lot of anxiety, and there's a lot of nowadays patients, as you know, they go through Google a lot, and nowadays it use ChatGPT, right?
mm.
So they come in with this breadth of knowledge, okay, which does not necessarily be evidence-based. So they have a lot of information, and sometimes that's when misinformation happens, and they have a lot of misconceptions, and it actually affects their treatment as well.
Yeah.
So and that sometimes when you have unrealistic expectations or you've misread something, you that in itself increases the level of stress that certain patients come in with. So when I journey with patients who have had infertility issues, or if they've had any difficulties in conceiving, or even difficulties in the early pregnancy, I actually do spend more time talking to them about not only the medical stuff, but more the emotional perspective.
Oh, wow.
Yeah.
Wow, that's so great to hear because, very often the waiting room is full of the doctor's clinics, and we as counsel completely understand that, a doctor might not have the time to see each and every patient for up to 1 hour or half an hour even, because with a full waiting room, you just have to go through all the appointments. But
Mm,
it's so great to hear that you actually set aside the time to have a deep conversation with these patients.
yeah.
Yeah.
It's really important, Tanya. I mean, one thing
Mm.
I realized through my experiences with the women is that the closure is very, very important. When I was back in a government hospital, I was extremely passionate about miscarriage, actually.
Oh.
So seeing a lot of miscarriages happen to my patients made me learn more about what miscarriages do to them,
Mm.
and it's a very difficult journey because I've got patients with multiple miscarriages, and every time they come in with a new pregnancy,
Oh.
they bring a lot of baggage with them. There's a lot of burden from what has happened in the past. So, like, I've got a patient who miscarried at 6 weeks, and now she's at 6 weeks mark, and she's thinking, oh, my previous miscarriage happened at 6 weeks. And this is a time for her when she's extremely stressed out about it. And I see this throughout all my patients. And if patients have had bad outcomes in the past, and there is, for example, a timeline where it specifically occurred, they are always stressed before that and even after that. So if you
Yeah.
can imagine that being extrapolated to someone who is had difficulty conceiving, I
Mm.
always tell my patients the stress actually starts even earlier than your
Yeah.
pregnancy. So that duration for patients who come in with infertility, that
Mm.
duration of stress is even longer. And they
Mm.
stress all the way to the point of giving birth.
Yeah.
So I acknowledge that, and I always spend time to talk to them about how to manage their stress. I spend a lot of time understanding what's their expectations and what's their understanding of the treatment that they're going through.
Mm.
And with that, that helps me assess the level of stress.
Mm.
And I really think it's important for us to address this from the start, because going through any form of treatment or even going through your pregnancy being stressed out like that is really not a good thing.
Absolutely. I
Yeah.
totally agree. And, I couldn't agree more when you say with those that actually, unfortunately, experience a loss, that we can see how stress is building up so much just around that timeline of a previous loss. And it actually carries through. You mentioned about like up to birth, but I would even see it postpartum. Sometimes it can actually negatively affect their ability to bond with their baby, which is
Correct.
really sad to see because all what we care about is the mom's well-being, the couple's well-being, but also the baby's well-being, really.
Yes, correct. So I
Yeah.
mean, this is why I always spend time talking to my patients. I say like, look, we need to deal with the emotional part of things, right? Because I feel that when any couple that comes in, there may be some underlying stress. So I take some time to assess the couple as well, to see what's the relationship like. If they're in a supportive relationship, often I see very good outcomes. It's very, very important, especially during IVF treatment, that you have your partner who is very supportive of you. So
Mm.
what I normally do is I assess, the patient's resilience, emotional resilience, whether they have good support, whether they know of any coping mechanisms when it comes to stress. And then based on that, I build upon that, right? So I take time to tell them, hey, this is going to be IVF treatment, especially, it's going to be a very long journey for certain people. We may not get what we want initially, and that's quite normal. Okay, that's quite normal, but we need to work together as a team. There is going to be some stress as you go along, but we are here to work together, and it's very important that they are very mindful of what their triggers are, what stresses them out, so that they know what they can do when they have triggers. And that's why I'm a very strong advocate for counseling.
That's really great to hear. Yes.
Yeah, because the mind and body, I mean, works together, right?
Absolutely,
Yeah.
absolutely. So that's why we spend a lot of time on that mind-body connection as well, because this is such an important factor. Lots of couples that we actually see, it's almost sometimes that they take their body and outsource it to the doctor and expect the doctor to fix their body.
Yes.
because they lost their trust and confidence in their body, maybe, especially with men, where maybe the sperm quality is so-so or really bad for some of them.
Mm.
They also feel really ashamed about it, and they feel that a loss of manhood as well that comes along with it. So it's really important to spend time on the triggers and on seeing like what brings them actually together as a couplet, what makes them become the magic strong team.
Yes, yes. I love it that you bring that up because actually what I tell my patients is the journey, your fertility journey is only the start,
Mm,
okay, of a test to your relationship together.
mm,
With a strong bond that you build as a husband and wife or as a partner, that is when you can form a strong foundation for your children.
mm,
Yeah, and that's very important when we're going to make a family, you're going to start a family. You want to be in line and you want to be supportive of one another because you will forever have triggers in your life. And you
mm,
need to know how to address those triggers when they arise. And only when you are strong together can you build a strong family environment for your children.
mm.
So I always
Absolutely.
tell them this is the first step. We need to sort this problem out. And I feel that actually for my patients where we teach these triggers, and I mean we teach them techniques on how to improve, or actually I send some of them to counseling as well. I
Mm,
said, you know what, just go for couples counseling, right? It's not about, hey, it's your fault or my fault, but it's about learning strategies on how to meet each other halfway, right?
mm,
And it teaches both of you strength in identifying each person's weakness and triggers, and it teaches the other partner how to deal with those triggers as well, how to be a supportive partner, right? So that's very important. Couples counseling, I think, is really, really important.
mm,
And with that, they are able to journey through IVF, which is a stressor in life. They can journey through pregnancy, which is another stressor in life, and they can journey through parenthood, which is a big, even bigger stress in life, right?
yes, as we know.
Yeah, exactly.
That's when you get to know your partner really good, because when it comes to upbringing your children, you realize, oh my God, are you serious about that?
Exactly. Exactly. That's the true test.
Yes,
Yeah.
yes, yes. I
Yeah.
also liked how you mentioned about that you actually take them really through about the IVF journey, because I have lots of clients who actually feel that IVF is a real shortcut to get pregnant, but it's actually not. And for many of them, it's hard to understand why it's not, because it seems so straightforward, but it's very
Mm.
seldom straightforward, to be
Yeah.
honest. I
Yes.
mean, some of the couples are very lucky, and it could be like one egg retrieval and one embryo transfer, and then the pregnancy is here, which is amazing. And as we wish for everyone this to happen,
Yeah.
but not everyone really experiences it. That's not the norm.
Yes. Yes.
Yeah.
You are totally right about that. Actually, I do feel that IVF is not a shortcut. In
Mm.
fact, it's a constant report card. That's what I tell my patients, right? So from the time you come to see me to the time I scan the follicles and I say, oh, great, you got 20 follicles, to the time I collect them, how many of them get injected, how many of them get fertilized? One of my patients told me, it's just a downward number. The numbers just go downhill, right? So
Mm.
it's like I always tell my patients, it's a constant report card, right? After
Mm.
your egg pickup, 5 days later, you get your report card. And then after that, you prepare for your embryo transfer. 2 weeks after transfer, you get another report card, whether you're pregnant or not. Then 2 weeks later, you come in for a scan. Then we assess whether you've got a baby's heartbeat. It's really, really a journey of resilience, because it's a constant report card every single, maybe twice a month or more
Yeah.
frequent than that. So it's really not a shortcut. In
Mm.
fact, it puts a lot more stress in couples as well,
Mm.
especially when a lot of us nowadays we're quite high achievers, right? And a lot of patients think that, oh, doing IVF, this is going to be it solve all my problems.
Yeah.
Yeah, so they come in with that kind of expectation, thinking like you're right, getting it right the first time around. And when they have set such high expectations from themselves and it doesn't work out the way that all of us want it to, naturally it opens them up to a lot of feelings of guilt, hopelessness, and helplessness. And that's the last thing I want my patients to go through because
Mm.
it is not their fault that this has happened. It's no
Yeah.
one's fault. And to go through it and feeling very hopeless and helpless is really not it's a horrible feeling to have. So
Absolutely.
yeah, so exactly my first consult When I first started out, my nurses used to allocate half an hour for my consult, and they realized, oh my God, she never finishes on time. So they've allocated me 1 hour instead.
Oh, oh, do they? Oh, wow.
Yeah, so they block out 1 hour of my time, and but
Mm,
I take the time to really go through the history. But
mm,
the half of it, the last part of it, where it's the counseling, I go through what the treatment is, the medical part. But I
mhm,
do tell them that, what we realistic expectations,
mm,
and also I spend some time in telling them it's a journey, and sometimes it can be long for certain people. And I tell them the importance of mindfulness, resilience, being supportive of one another. And that's when I actually assess, the patient's emotional resilience.
mm.
And after that, if let's say I feel they need counseling, I'll say, it is a very stressful process for certain patients. They would benefit from seeing a counselor, because it's good to kind of you know inform someone of your, explain your feelings or share your feelings with someone.
Yeah,
And these people and the counselors are really good, because not only do they listen, okay, but
mm,
they can give you strategies to help you
yeah.
deal with all these stressful triggers when you're going through the IVF program.
Yes, absolutely. And what we see also very often is they actually experience so many different losses. We call them reproductive losses
Mm,
because it's the loss about, first of all, you realize that you can't get pregnant naturally, maybe so easily, like seemingly your friends are. And
mm,
secondly, then you start having that experience of losses, maybe of not having those fertilized eggs that you were hoping for, those embryos, maybe not that pregnancy that happened with the first or second embryo transfer. So there are so many, there is such a variety of different losses that a couple can experience along an IVF journey, that we can truly feel the grief actually that is happening.
yeah,
And grief for men and women is very different. They
mm,
cope with it in a very different way.
yeah.
So I think it's great that you actually point out to them to see maybe someone else and in a non-judgmental and safe environment to talk about their feelings and emotions.
Yeah, yeah. That's really, really important.
Yeah.
I guess for me, since I have always been in this, since I've been practicing for almost 15 years now,
Hmm.
I've seen my fair share of patients' losses, and
Mm.
I've shed, tears with them as well.
Oh.
Sometimes it's really quite hard to be completely professional and
Mm.
take yourself out when your patient is crying, and you just feel like, I really feel her pain, I think that it's as much so seeing my patients go through that kind of grief, I emphasize a lot on prevention, if you get what I mean.
Hmm.
So I don't want to see them grieve. I don't want them to see them lose hope and feel very helpless and thinking that it's their fault. So we
Mm.
spend time talking, like I said, talk to them about, being realistic about their expectations, and knowing sometimes it may be a little bit more of a challenging journey together. And to be honest with you, Tanya, I see this amount of this half an hour more of time that I spend with them, I actually do see results.
Mm.
Like, most of my patients are really very chill.
Oh.
So that time setting the bar, setting the expectations, really educating them, and telling them what to look out for, being educated on that, they actually know that, okay, it is going to be a bit stressful, but hey, we can go through it together. I've got a supportive partner. If I feel very stressed out, I can always seek Dr. Lily out, and
Mm.
she has counselors available for me to see. So there are things that I can do about it, so they don't keep everything inside. So when they
Mm.
go through the IVF cycle, naturally when they come for scans, I'll say, so how are you feeling? How's your mood? Any stresses, anything you're concerned about, anything you want to discuss with me? I normally would address their concerns every single time. So
Mm.
normally when they come in for the egg procedure, the egg collection procedure, they're pretty chill. I mean, like recently, just giving you a very recent example, I had a 43-year-old. Um, she first IVF cycle ever.
Oh, wow.
Yeah, and she had such a it was a very, very good cycle, a successful cycle. She came in, and I said, at 43, the egg quality and quantity may not be so great, but let's see what we can do. I assessed her relationship with her husband, very supportive husband.
Mm.
Okay, and very determined couple together. They even changed their eating habits. They were eating very clean and all that, even before starting IVF with me. So I felt, oh, they were in this together. They were working as a team.
Mhm.
So I felt, okay, this is good. So along the way, that cycle went better than expected. We collected quite a number of eggs. She's got two good quality blastocysts frozen now. For a 43-year-old, that is amazing to me.
Ah, yes.
So I looked back at her cycle, and then she said to me recently, actually, what did we do? She said, what did we do? I said, well, I mean, we didn't do anything extraordinary, but I
Mhm.
felt that both you and your husband were playing as a team, and you
Mm.
guys were very supportive, and you went through the whole experience very positively. And I think
Mm.
that made the difference. We
Yeah,
don't know what stress does to the body, isn't it?
absolutely. Yes.
It made
Yes.
such a difference. And because she was very realistic on what to expect, when we had the
Yes.
two good blastocysts, she said, I can't believe it. She
Ah,
was over
wow.
the moon. I was very happy as well. And
Yes.
this is one of the examples I share with my patients when they come in and I sense some stress and I'll say,
Mm.
I've got patients. Everyone comes with some stress, but it's
Mm.
very important for you to manage your stress. And
Mhm.
often I see very good outcomes from patients who are very relatively stress-free during their
Mm.
IVF.
Yes, yes, yes. I'm having so many goosebumps right now. All over by just listening to you, Dr. Lily. I love these stories. I just love them. Thank you. And it makes you also so human, the way how you explained about that you would actually shed some tears with your patients as well. And I think that makes us human because no matter how many certificates and diplomas we have, but at the end of the day, we are here, yes, to professionally help our patients, but also to be really there for them.
Yeah,
And they can feel if you put your heart into it as well. They
yeah.
can feel it. Absolutely. Yes. Yeah. I was wondering, with the IVF treatments that you have been seeing, and with all what is available nowadays, the all the alternative therapies, you mentioned counseling can work.
Yeah.
Is there anything else that you saw from your experience now that has worked very well with some of your patients?
Well, I'm a strong believer in healthy lifestyle.
Hmm.
So I
Obviously.
normally, yeah, I normally tell them. To eat healthy. Okay, so instead of focusing on what we cannot change,
Hmm.
right? So I tend to refocus them. I said, as I can't predict how your cycle will go, I can't predict how many blastocysts you'll get, but let's focus on what we can change. So
Hmm.
focus on your diet, cook well, eat well, have your antioxidants, your lean meats, your fishes, whatever,
Hmm.
and exercise. Okay, of course, we do advise them not to do strenuous exercises while they're on the stimulation program.
Hmm.
But normally, I still say go for your walks, get some vitamin D. It's great for you. You know,
Yeah.
go out with your friends, just practice being normal. Don't
Wow.
shut yourself out because you're having an IVF. You're going through IVF, right?
Hmm.
So I always advise them to be as normal as much as possible.
Hmm.
And I always focus on the stress part of things.
Yes.
That to me is not alternative medicine. That is actually very, very important.
It absolutely is. And actually, going out and being in a social environment and everything can help your stress to actually decrease. It's really like
Exactly.
proven in studies as well.
Yeah.
Absolutely. Yes. So it's really something that we focus on as well to just because you're going through an IVF, you don't put your life on hold. I
Mm,
hear this so often from our clients that they are putting their life on hold. Some of them even quit their job to fully focus on their IVF. And sometimes I feel, yes, it could be maybe a good way if it's really helpful.
mm.
But for some women, they just have so much time to think about. And
Yeah.
sometimes I think it's not healthy either.
Yes. Yeah, I mean, I totally agree with you. It's kind of like not solving the issue at hand.
Mhm.
So I always believe in you need to find out what's the cause, and then you can then address the problem itself, right? So for some women, they maybe feel, oh, for some women, really, they really do need to quit their job, right? Because it's such a stressful job, they really have no time to rest and they're constantly on their feet. Fair, right? Because they really need that time to rest during their procedure or while they're going through IVF, or it's too stressful for them. And if they have identified that as a significant cause of their stress, and they
Mm.
would like to use that as quitting their job to be one of the strategies to de-stress, Fair enough. But actually, to be honest with you, the bulk of the women
Mhm.
actually they're so used to working already. Sometimes, like you're right, like when you have too much time on your hands, it's
Mhm.
not going to help as well. So if you're going to spend the time worrying
Mhm.
about your outcomes, I tell my patient, you're better off going to work, because then that takes your mind away from things. That gives you some form of normalcy in your life, and that gives you social interaction.
Mhm.
And I think that's the most important thing, essentially, is to identify what is the thing that's really causing you a lot of stress. Yeah.
Yes.
Yeah. So I have patients on IVF who really decide to quit their job, right?
Mhm.
Because, for example, they don't even get a break. So even out of work, their boss is texting them, they've got things to settle, so they don't even get time for themselves at all. So they say, look, I've just had enough. I really need to practice a little bit of mindfulness for myself. I need to address those stress. And doing all these extra, these mindfulness activities helps them de-stress. So they quit their job.
Yeah.
But
Mhm.
it's not for everyone, to be honest with you.
Yes, yes.
Yeah.
And this is very important to actually take away here that, for some women, this works extremely well to
Yeah.
quit their job and they can handle it very, very well. But for others who actually might see that their mind is going even more into the worry state, maybe that's not the right thing to do. Yeah,
Yes, correct.
absolutely. And Singapore is a very high-paced and very high intensity place to live. There are so many women who feel highly stressed, really.
Yes, I
Yeah,
totally agree with you, which is why I told you my mindfulness activity is
yeah,
swimming. Because I'm in the water, nobody can contact me. I'm
yeah,
not with my phone. I'm completely blocked out for 45 minutes. So that's my mindfulness activity, is just to get away from everything.
yes, yes, yes. You're so right about it. And I really hope that you can keep that for yourself, Dr. Lily.
It's important because it sets my mind for the day, actually. It preps me
Absolutely.
for my busy day.
Yeah,
Yeah.
absolutely, absolutely. And you seem to be a doctor that really practices the present moment and to be present and mindful about each and every patient. So probably if one would be your number one patient of the day and one would be your last patient of the day, they would both actually get the same quality of advice from you, I'm sure.
Yeah. No, no, yeah, that's what I do.
Yeah.
Because that's why it's important to kind of recharge my battery
Yes, yes, yes.
before my day starts. Yeah.
Another topic that actually we come across very often besides stress, it's also PCOS and endometriosis.
Mm.
I saw that you had a video on PCOS on your Instagram. Yes, Dr. Lily has an Instagram, and we will post it in the show notes. Um, so I'm wondering, can you maybe for those listeners that haven't seen your Instagram yet, can you maybe walk us through what PCOS is and how can you help those women with PCOS?
Okay, so PCOS is polycystic ovarian syndrome. So basically, being a syndrome, we do need to fulfill 2 out of 3 criteria. So the first criteria is irregular menses. Okay. Second criteria is presence of very small little cysts, so polycysts, many cysts in the ovaries on an ultrasound scan. Okay.
Mm,
And the third criteria is actually high testosterone levels, be it clinically, so you may see patients with a lot of pimples, they might have some facial hair, or it could be even on a blood test. So
mm,
if you fulfill 2 out of 3 criteria, then your doctors will tell you that, oh, you do have polycystic ovarian syndrome. Okay,
mm,
we do see that commonly, and it's actually linked to metabolic syndrome as well. So metabolic syndrome is where patients have a higher risk of developing things like high blood pressure, diabetes, obesity. So there is a more medical, long-term component to it as well. So with PCOS, the issue is that when they have irregular menses, it's usually because they do not ovulate every month.
mm,
So because you don't ovulate every month, i.e. you don't produce an egg every month, that makes it a little bit more difficult to conceive. It doesn't mean it's impossible. It's just that it may not happen every month. So in a
mm,
way, it's kind of hard to time your, intercourse. For a 28-day cycle, we tell people, okay, you just try during your ovulation period.
mm.
But for someone who has PCOS, it's quite hard to tell them when to try.
Yeah.
Having said that, I've got patients with PCOS who get pregnant very easily.
Oh,
But that just
really?
means, yeah, they get pregnant themselves without
Oh,
any help. Yeah.
oh,
But that just means that you just need to have very, very regular intercourse. So, in that off chance that the egg decides to ovulate, the sperm
yeah.
is there waiting for the egg. So that's how they get pregnant naturally. So it's
Mm,
not impossible.
mm.
Yeah. But certainly with patients with PCOS, if they need help with the ovulation part, we have very simple tablets that we can give them during the first day 2 to day 6 of their menses for 5 days to encourage the growth of the follicles.
Okay.
And normally we do a blood test on the 21st day of their cycle just to make sure that they're ovulating on the dose that we've given them.
Oh,
Yeah.
fantastic.
Yeah. So it's just a simple thing like having a tablets. But of course, that's provided that the sperm count is good and the tubes are patent. Because that's
Oh,
the other two things that needs to happen before one can fall pregnant naturally.
okay. So
Yeah.
that is the natural option. And how
Yes.
about for those that actually would like to venture into IVF and have PCOS?
Mm.
How would that work?
Yeah. So eventually, if the more natural option doesn't work, then you can talk about things like IUI.
Mm-hmm.
Intrauterine insemination, where we give them the ovulation tablets as well. Some doctors give injections to improve the growth of the follicles. And
Mm-hmm.
then we inject the sperm directly. We place the sperm directly into the womb. So it's a bit closer to where the egg is.
Mm-hmm.
Um, that's the next step up from the natural IU, I mean, the more natural route I was mentioning with just the tablets. And of course, the final step would be IVF.
Mm-hmm.
So of course, we do know that patients with PCOS, they do have a lot of eggs, but they don't actually grow every cycle, right? So what
Mm-hmm.
happens if I were to inject these patients with hormones? You will have a lot of eggs growing.
Mm-hmm.
Yeah, so sometimes you can collect 20, 30, 40 eggs in
Oh,
one egg pickup cycle.
oh my goodness.
Yes, so it's
Yeah.
a lot of eggs. So numbers definitely we have, but
Mm-hmm.
sometimes we may not have very good quality eggs as well.
Mm-hmm.
Yeah. And of course, there's always this risk of being hyperstimulated during the procedure itself, because you can imagine for a normal woman, we probably pick 10 to 15 eggs, Someone who's older, we pick maybe 2 to 5 eggs and stuff. But if you have 20 to 40 eggs, you can imagine how bloated you will be, how enlarged the ovaries will be. And after they've gone through the egg pickup, when we give them the trigger medications, sometimes that drives them into ovarian hyperstimulation syndrome
Mm-hmm.
because they've got high levels of hormones in their body because they've got so many follicles that have been picked up. And that increases the risk of complications of OHSS, which is ovarian hyperstimulation syndrome. And they can get fluid in their lungs, they can get fluid in their tummy, they can be very unwell, they have higher risk of clotting in their body. So it's something that I often share with my patients. Of course, we are always very concerned, very worried, and we're very cautious about this complication happening in patients with PCOS. So we do have steps necessary. We do have steps to prevent that from happening as much as we can.
Yeah, absolutely. Fully understand. So
Yeah.
would you see these patients more often during the hormone stimulation phase then?
Some of us will,
Yeah.
depends. For me, yes, I may scan a little bit more, but it
Mhm.
also depends on how well the eggs are growing. But
Uh-huh.
normally, if I'm worried about ovarian hyperstimulation, I may see them a little bit earlier as well.
Yeah.
But yeah, we do give them general advice what to do, what to look out for, and when to come back. And like I said, there are actually very good techniques that we can employ during the stimulation cycle and even post-stimulation cycle to minimize the risk of OHSS significantly.
Hmm.
Mm.
Hmm. Okay. Okay. So am I right to understand that you actually always try with your patients to look at natural fertility options before moving on to IUI and then eventually to IVF?
Yes, I am a strong proponent of that.
Uh-huh.
So I've had patients who come in, they're a very cute couple. Remember this couple, they are 38 years old, just got married for 3 months, tried
Oh.
for 2 months, and they came, they're like, oh my God, doctor, I cannot fall pregnant. And then
Mm.
I say, why? What's wrong? They say, oh, we've tried for 2 months. I say, oh, 2 months? We normally advise trying for 6 months. And they went, no, 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 we need to do the investigations now. I mean, she's old, I'm old, we need to find out what's wrong.
Mm.
So it was very funny. I saw them during the mid cycle. So when I scanned her, I said, oh, you got a very nice follicle, go back and try. So that's why I say the husband had the sperm test, she had a blood test done, and then she came back 2 weeks later to see me. And I looked at the sperm test. I said, oh, that's not too bad. Came in,
Mhm.
I said, oh, sperm test is good. Egg count is still pretty good. Then the wife looked at me, doctor, we are pregnant. I said, see, I told told you you didn't need IVF.
Yeah,
We just need some time.
exactly, exactly. And I think, is that something that you are seeing as well? That so many couples don't seem to have time.
Yes, that is
Mhm.
true. Yeah. It's quite sad. I think you did mention earlier on Singapore is a very highly stressed country.
Yeah.
Everyone works so hard, you know. Actually, it's quite hard for them to find time to be together
Mm,
and
mm,
what more be intimate. And a lot of times they are really very tired from work.
mm,
So we do see that sometimes it's that could be one of the reasons why people have difficulty conceiving as well. So that's why I take the time to understand and explore the reasons. So you know, young couples come to me, they're in their late 20s or their early 30s, and we've done preliminary checks on them. There's nothing really wrong, and the issue is just the frequency of intercourse. I would tell
mm.
them, you know what, take your time, go on a holiday, right? Just don't be in Singapore, and then go and try.
Yeah,
A lot of them come back pregnant naturally.
yeah,
You know,
yeah.
I always tell my patients this, you see, a journey for fertility, if you try naturally,
Mhm.
you're not stressed out, right? Because the only time when some people start stressing out is when they've got a positive urine pregnancy test,
Yeah,
you know?
yes.
So,
Yeah.
but from ovulation to fertilization, to implantation, to growth
Mhm.
of the baby, I have no idea until I've missed my menses 2 weeks later. And by then, you know, I've not stressed for 2 weeks. You know, conversely with IVF, you're
Mm.
stressing all the way from the time of follicle development all the way to egg pickup to transfer date to all that. So I always tell patients, you know, if you can, and there's no contraindication, there's no real reason why you can't fall pregnant naturally, go the natural route first.
Yeah, absolutely.
Save you money as
Absolutely.
well, save you stress.
Yeah, exactly. You mentioned something earlier that I picked up a little bit more about recurrent miscarriages.
Mm,
Um, when women are or couples are actually going through a loss, and sometimes it's one loss after the next that you are seeing.
yeah.
I often get asked about like how long do they need to wait until they can try again? Is there something that you would advise for your patients on taking a break or continuing actually to try?
Okay. I normally tell them from a medical point of view, I would
Mm,
advise at least 2 menstrual cycles before you try
mm,
again. So the
mm,
first menses after the miscarriage, that's the first menses, and you wait for one more menses, and then you can start trying. But that's the medical point.
mm,
So I often tell them that when we manage miscarriages, actually the medical part is the most straightforward thing.
mm,
It's very straightforward what we do for miscarriages. It's only three options, right? Whether we manage it conservatively or we give patients medicine or we go for surgery.
mm.
The most difficult part is the emotional part that comes with a miscarriage.
Yeah.
And that's why it's not something that it's something that I really focus on more. Once
Mm,
I kind of dealt with the miscarriage and I feel that my patient is in the kind of mindset where they have already accepted the diagnosis,
mhm,
that is when I come and I talk to them about the importance of closure.
mm.
So
Yeah.
I spend a lot of time telling them that most miscarriages would happen because of a genetic defect with the baby. It's not something that you can control and not something I can control. And it's not something that you did to cause a miscarriage. You know, because some patients will ask me, Dr. Lily, I went for a run, you know, I went for a marathon, you know, or I even something, sometimes they'll say, oh, I had a cold drink. And after that, I started bleeding. Is it because I had my cold drink? You
Mhm,
know, and I always dispel these myths. I say that no, it's not your fault. Even if
mhm.
you came to see me on the day you had a little bit of spotting, there's nothing I can do.
Yeah.
Short of giving you some hormonal support, but a hormonal support does not change a genetic problem with the baby,
Mm.
right? So I take a lot of time to explain it to them so that they understand that it is not their fault.
Yeah.
Yeah, because I've seen countless women come to me from their previous miscarriage with a lot of baggage.
Mm.
And you know, they will blame themselves, they have a lot of guilt, they feel very stressed, they have a lot of high levels of anxiety. So it's always important to close the chapter after the medical part of miscarriage has been resolved so
Mm.
that these patients can move on with their next pregnancy.
Yeah.
Not thinking that, oh, I'm going to have a miscarriage again, you know, it's because I did this or my body is too weak, you know, I can't hold my pregnancy, you know. I've had a very interesting patient of mine. that I will remember her for the rest of my life, actually. She is a true, she's really like the strongest woman I've met.
Wow.
Yeah, so this lady, when I met her, our normal history taking, you say, oh yeah, how old you are, blah, blah, blah. So how many miscarriages have you had? This kind of question. Have you had any miscarriages in the past? And she goes, more than 10. And I said, huh? More than 10? I said, more than 10. And she says, I can't remember. It's definitely more than 10. So she said, and then I was like, this is really recurrent miscarriage. So I went through the whole history, when it happened. Have you had any investigation? So they have other doctors before me have investigated everything, and everything is normal.
Mm.
So she tells me, she says, actually, doctor, I get pregnant easily, but I can never keep my pregnancy. So every time I think I'm pregnant, I don't even do a urine pregnancy test because I'm pretty sure I will lose this one. So
Mm.
when she saw me, she waited a very long time to see me. And she came at, I remember, almost close to 10 weeks.
Oh, wow.
Yeah. And she said, oh, this is quite long. It's lasted long. Maybe time for me to see a doctor. So she made an appointment to see me. And that was how I met her for the first time.
Mm.
And then I scanned her. I was like, oh, that's a baby's heartbeat. Congrats. And she goes, yeah, doctor, I've had miscarriage at 12 weeks, 15 weeks before. And I could feel her anxiety. I said, so have you tried, what medicines have doctors given you in the past? She said, oh, she's got injections, blood thinner injections. She's got aspirin. She's been on high doses of progesterone injections, and blah, blah, blah. So I went through everything and I said, well, if all the investigations are negative and you've had all these jabs in the past and none of them had worked, and to be honest, they're not really evidence-based because you have not tested positive for anything on the blood test. So I said, let's just give you simple oral progesterone. And then she says, okay, sure. So, she trusted me then. I said, look, I'm not going to do anything that's not evidence-based, yeah, but okay, minimally oral progesterone. And she delivered that baby at term. Can you imagine,
Oh,
Tanya?
wow. Oh my goodness.
Yeah, that was her
Oh,
first pregnancy after almost 10 years of her marriage. But
wow.
I assessed the couple so supportive of one another.
Mm.
Husband is extremely supportive. She's also very open-minded. She took it with stride. And
Mm.
every time I see her, I'm very stressed. I'm actually stressed, but I don't tell her that, right? Before I scan her, I'm thinking, oh my God, I hope there's a baby's heartbeat. So I
Mm.
was also very involved in her care. And I remember when I delivered her first baby, I teared. I
Yes.
teared because I carried that baby that she's been waiting for 10 years, and I handed the baby to her.
Yes. Yeah.
And I didn't do anything, Tanya. All I did was emotional support during her whole pregnancy.
And that's exactly what you probably needed.
Exactly.
That's
And
exactly.
nothing. I didn't do anything.
Yes. Yeah.
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 And
Yeah.
amazingly, subsequently, after that first live birth, she's
Hmm.
had two other live children back to back.
Oh,
So she's got three
really?
kids now.
Oh, oh, wow.
Yes.
Wow.
So,
Okay.
and this is a story that I share with all my patients who are in true despair
Yeah.
after their miscarriage.
Mm.
I say, you know what? The doctors will tell you, oh, yeah, chances of miscarriage happening is 1 in 5 every pregnancy, right? Of course, as you have more and more recurrent miscarriages, then the chances of it happening again is slightly higher.
Mm.
But you know what? I always tell them the odds are always in your favor. Even
Yes.
if the lowest number, your chances of having a baby at the end of the day is 60% or 80%, the odds are forever in your favor.
Yes.
And I always take this time to share this story with them, the ones I just shared with you, and that gives them a lot of strength because this patient of mine had the resilience, the importance of the emotional resilience, and the importance of that couple's,
Mm.
strength,
Yeah.
and the trust they had in our doctor-patient relationship allowed us to achieve this together. And I think actually that's the crux of this year is really important. That's what I feel.
Absolutely, absolutely. And by sharing actually these inspiring stories of other patients of yours, it really can give them hope back again, right? Yeah.
Yes,
And it
yes,
seems that with some of the patients, actually, it's also a belief question because when they experience one loss after the next, they start to kind of like almost embrace the belief, I can't get pregnant.
yes.
I had actually patients who signed up for an IVF, and then we were working with counseling tools and everything else. And then towards the end of the session, this patient tells me, "Oh, anyway, I don't think I will be actually becoming pregnant with this embryo transfer."
Oh, so
And
sad.
and then I'm looking at that and I'm saying, well, why on earth do you want to then sign
Mm,
up and go ahead? Yeah, because the doctor said it's good timing. I should go. And I said, actually, you know what? We should work on your belief system first before you go in for your embryo transfer. Yeah,
yes.
so I see
Yes.
this very often that they start to reverse almost their belief system.
Yeah, correct. Actually, that's not very healthy.
No.
It's actually not, it's just you're in that hopelessness or the helplessness cycle already,
Mm, mm,
right? And you know, it's everything we do in medicine is always giving patients numbers, statistics, and stuff like that, right? And but I always like to turn the numbers around, not
mm,
because I want to give them false hope, but
mm,
I always feel that it's important to tell people that in life, nothing is impossible.
yeah.
Okay. So,
Yeah.
you know, I recently did a transfer for one of my patients. It was her first transfer was not successful, unfortunately. Her second transfer was of a blastocyst that was of what we call poor quality. And I told her, I mean, pregnancy rate is about 10 to 15%. And she said she was very positive. Also comes from a very supportive husband, you know, and this is a couple I've, you know, I mean, we've been having a chat since the egg pickup days, and I said that, yeah, don't worry, we'll try this cycle. I said, you know, 10 to 15% is better than zero. If we don't transfer, it is zero. If I
Mm,
transfer, that 10 to 15% will mean something. She'll say,
mm.
"Yeah, okay, let's do it." Guess what? She's 10 weeks now.
Wow, amazing. And this is
Amazing.
a blastocyst that is actually a so-so quality, what we say, right?
Exactly.
Yes,
Exactly. So,
yeah.
you know, never ever look down at the blastocyst. Never
Mm,
ever look down on anything in life because nothing is impossible. Right? And
That's
it's
so
so
right.
sad. It's so sad to hear your patient like feel so broken like that, that you know it's not going to be successful anyway, because if you go in with that kind of mindset, it's
Yeah.
really not going to be healthy at all.
Yeah, yeah.
Yeah.
I'm okay when they say like they don't want to think too much about it, and that's totally okay for me. But if they go in with this almost strong belief, I
Yeah.
can't get pregnant anyway, that's really triggers my alarm bells, you know. That is like
Mm.
when I go like, okay, we need to talk about this because this is not a healthy state.
Yes,
Yeah,
definitely, definitely. I think they're probably maybe in a denial state, or they just don't want to accept negative news, so they prepped themselves in that way.
yeah,
Some people are
yeah.
like that, like just
Yeah.
more defensive than usual,
Yeah,
right?
absolutely. And I
Yeah.
think it's also a protection mechanism to some sort, which I completely get, you know. You think of the worst and hope for the best.
Yeah.
Um, and
Yeah.
this is like, so when we usually explore a little bit more, it turns out actually that this patient of mine always approached all her exams in life like that. She always thought,
Ah.
she always went into exam thinking she would fail, and then she would actually score at one of the best in class.
Ah, okay, okay, okay,
Yeah. So
okay.
we found out it was a coping mechanism
Mm,
for her, and then she kind of like embraced it that to really think of the best, it doesn't mean that it hurts you less, because
exactly.
if you get disappointed by a unsuccessful embryo transfer, it hurts. It hurts if you think positively, and it hurts if you think negatively.
Yes,
And actually, it's the same at the end, you
yes.
know.
That was what I was gonna say. Regardless, she was still hurt,
Yeah,
right? So
exactly.
don't go through it with a very negative mindset.
Absolutely.
Yeah, and sometimes with that negativity, it may also affect the partner as well.
Yeah.
It can affect the dynamics of the relationship. I think it's very important to deal with that because like and going back to what you said quite earlier on is that men deal with going through stresses of IVF very differently compared
Mm,
to women. Yeah.
mm.
I get the men's perspective a lot because actually my husband is he's got a psychology degree and he's doing his masters of counseling, so he comes from a male's perspective. He
Yes.
tells me, you cannot always, you must remember, you must also focus on the men. I said, yeah, yeah, yeah. I assess the couple, make sure that, they've got, mechanisms, they've got things on how to manage their stress. He said, because men deal with stress very, very differently as well. And,
Yeah.
when you have one of the partners is very negative, naturally it will bleed into the other partner as well. And
Yeah.
that affects the relationship. Yeah.
Yes, yes. That's
Yeah.
why we we always emphasize on actually having both of them in our sessions when they
Yeah.
prepare for IVF as well as for an embryo transfer, because
Mm.
we say there is so much that, your husband is learning as well, because an IVF seems all about the woman, because she's the one going through through the hormone stimulation, through the surgeries and procedures and everything, and the man is put into a situation where he just needs to deliver the sperms, right?
Yeah.
But then we often say to them, you actually play a really major role in here. And
Yes.
we really shift also help to shift the dynamics in this couple relationship. Yes, we acknowledge that the procedures are all done on your wife,
Mm.
but you are the rock in the ocean.
Yes.
And you are solid and grounded, and with your calm, you can help a lot your wife to go through this fertility journey.
Yeah.
Yeah.
Totally agree with you. Yeah. I've had conversations, patients' husbands saying, yeah, it's okay, lah, doctor. I'm not the one going through it anyway. She's going through all the pain.
Yes.
And I said, well, you guys are in journey together. You guys are partners in this
Mm.
together. So, you men are actually very, very important because, like what you say, the emotional support that they provide actually helps the women a lot. And, the positivity is very,
Yes,
very important.
absolutely.
Right. So
Yes.
yeah, I think I always tell them, oh, don't think that you don't have to do work. You need to support
Mhm.
her, you know?
That's so true. That's so true.
Yeah.
And there is so much that they can do, especially during the 2 weeks waiting time. We give them lots
Mm.
of tools that they can do because it's really about also treating your wife as the queen bee, right?
Yeah, correct. Correct. And like we've discussed earlier, it's so important to spend time together, just take your mind off, oh my God, I've got 14 more days, 13 more days, counting down to the day that you do your pregnancy test. Oh,
Yeah.
it's a really long. They don't call it a 2 week wait, 2 week wait for nothing. It's really long for
Yeah.
certain patients.
Yeah. It can be
So I
really
can
difficult.
totally understand. But I always like I always tell them, right? Focus on the things that you can change.
Mhm.
Right? So you're right. Spend time, go on a holiday together. Don't stress. That's very important.
Yes,
Yeah.
absolutely. I want to follow up just on a quick one that you mentioned about the myth and misconception. Can you share a little bit more about your favorite myth and misconceptions that you came across?
Okay, I mean, one thing I come across very regularly, I think we discussed this briefly before, is that IVF is the quick fix.
Mm,
It fixes everyone's fertility issues on the first go.
mhm,
That's a very, very common myth because when you look at the studies, it's all about cumulative pregnancy rate, it's about cumulative live birth rate. People need to end up most people do about 3 to 4 cycles to get there.
mhm,
Okay? But a lot of people come thinking, oh, well, I've been not successful on my own. Let's push everything to technology and let's try to do it that way.
mhm.
But at the end of the day, there's only that much that technology can do, right?
Yeah.
I cannot improve egg or sperm quality. I mean, to an extent we can, but not totally. And a lot of the time when the embryos are growing is really dependent on the egg quality as well after fertilization. So that's not much that we can do. And that's one of the biggest myths that I get, and I always address it at the first consult.
Okay.
um, not because I am, I don't want to overpromise, but
Mm,
it's just that I have seen many patients fail, not get it right the first go, and they just break down completely. And they think, am I a failure? My friend got pregnant the first cycle. How come I can't get pregnant the first cycle? And it turns into a lot of guilt. It turns to a lot of hopelessness, helplessness, despair, and it
mm,
really breaks them down. And I do not want to see them go through that. So I normally tell them, we all try our best, right? You're here because you trust me, right? I'm your doctor. So we work as a team. You, husband and wife, work as a team as well. Be supportive of one another and let's do it together. It's
yes.
all about teamwork and it's all about, preparing yourself for a very long, sometimes stressful journey together.
Yes.
Yeah. I
Yeah.
always tell patients it's a very long journey. So let's not make it stressful for everyone. Okay. Let's look at this more from a positive, light.
Mm.
And sometimes it really may take some time for us to get there, but we'll journey through it together. That's the most important thing.
Exactly.
Yeah.
Exactly. And the feeling that they get that you are here for them no matter what.
Yeah.
I think that helps a lot because that gives them the confidence that they can trust you and that you got their backs. And
Yeah.
this is like where I see very often the miracle actually happen when patients trust a doctor, they start to let go. And
Mm.
when this happens, the magic happens.
Yes, actually, it's very true.
Yeah,
That's why I always tell my patients, hey, you guys must be as chill as possible. It's already very stressful for you. So
yeah,
let's not make it extra stressful. We deal with the things that we can change, right? And as I
yeah.
mentioned, all of them are quite chill, to be honest.
Yes, yeah,
Yeah,
and that's because of you, because you are actually projecting them, projecting yourself to them. You're
yeah.
calm and everything. Yes,
I
amazing,
try.
amazing. I love it, Dr. Lily.
I always joke with my patients, right? I said, you pay me so much, right? And if you're stressed to see me, maybe you should change your doctor. I'm here to take away your stress. And then they say, yeah, actually. So I said, let me do the stressing out for you, right? I don't mind getting a few white hairs.
So true. That's such a lovely way on how to put it, actually. I never heard this.
They will all laugh. They'll be like, haha, you're very funny.
Yes. And this is also what should be actually part of it, to make it a good laugh, to have really also these light moments on
Yeah,
the
correct.
journey, right?
Yeah, I mean, I
Together.
really, really try to
Yeah.
lighten things up in the consult because it's so stressful to see the doctor already, right?
Yes. Yes. Absolutely. Absolutely.
Yeah.
Well, we're coming up to an end for today, and I thank you so, so much for all your insights, Dr. Lily, and for all your wonderful stories that are so heartwarming. I got goosebumps all over and almost some tears actually with your stories. Thank you. Thank you so much
No
for
problem.
sharing.
I've got
Um,
more to share. Next time, if you want, we can have a
Exactly. I
conversation.
just thought,
But
like, I would have actually so many more questions, but I think we also need to maybe just put an end over here today and then follow up with a, with a separate podcast again. Can I ask you, so just as a closing question? Actually, I have two more questions. So
okay.
a fun question and one for our listeners. So the fun question would be more like you have a day for yourself, and I'm fully aware that you have a 2 years old at home, as well as a husband and a job. But let's assume you have a full day to your own. What would you do with that day?
Ah, I like to recharge my mind.
Mm,
So once again, I would love to swim, and I normally would love to sit by the pool and just soak up some sun. I like my vitamin D.
mm,
So definitely I really like the mindfulness part of things. I like to recharge my mind. I like to take my mind away from things sometimes so
mm,
that when have I can work better. I clear my head.
mm,
So swimming, I like the gym as well. I do some weights. Coffee, having a cup of coffee, just sitting in the cafe alone, just having a cup of coffee and just observe, just being in that moment itself. That's what I like. So I like to sit in a place. I like to just focus on listening to things, looking at things, and just being in the moment. I think that's very important. Yeah, of course, I like to do mindless things like watching documentaries, true crime documentaries on Netflix. That's very mindless to me, but that's not truly mindfulness. So yeah,
yeah,
I love to have some time my own with mindfulness, but it's hard. It's hard but my 2-year-old daughter is really cute as well. And to be
yeah,
honest, I never have much time for myself. But the only time I have for myself is when she's fast asleep. So that's why I wake up at 6 something to swim in the morning. So
yeah.
she's asleep.
Yes, and it's so important to have this awareness of how you can still build in your mindfulness moment
Yeah,
in a busy life. And I
yeah,
think if you can do it as a doctor with a 2 years old, so many others can do it too. And
it's
I think
true.
that's really, really inspiring, Dr. Lily. Wonderful. Yes.
You.
And maybe as a closure for today, so would you have like a message of encouragement to all
Mm,
those that are listening to us today and are maybe on a fertility journey, whether they are thinking about it or have been on it already for some time? Is there anything that you could actually share with them?
mm. So the fertility journey can often be very challenging, but everyone's journey is very, very unique. Okay, so don't compare yourself to other people. Just focus on yourself. I always tell my patients to focus on, the positive side of things and actually prioritize their own self-care, because that actually helps them to build resilience, and that resilience that they build and they learn to build from their initial fertility training will actually go very far with them. Because when they actually do fall pregnant, they need all these strategies to help them stay strong in their pregnancy. And like I said earlier on, once you become parents, you need to employ these strategies even more.
Mm.
So I always feel that, strong couples relationship is a very important foundation to building a strong family together. And I always tell my patients, never ever forget, don't always think that you're alone in this. There's many other people out there, there's support groups, and I always tell them, if you have any issues, please talk to me, right? Because I give you the more medical, more evidence-based kind of point of view, but I also have the ability to address, certain sort of emotional issues that you're going through. I'm not a full-fledged counselor. Whatever counseling I learn from is from my husband or my sister. They're both psychologists, right? So I learn from them. But at least I can tell them, hey, I have counselors available who are well trained in fertility, who can actually help you with this. I'm not a professional counselor myself, but there are actually professionals who can help you out with this. And it's really important to know that you have options like that. They need to know that they have this service available so that they can speak up and inform us of the issues. And always take this opportunity. It can be a very difficult time, but take this opportunity to build a very strong bond with your partner, because this is actually a partnership for a lifetime.
Mm.
And this fertility treatment they are going through is just a little small bump in the road, right?
Mm.
But your journey is still very, very long together,
Oh,
you know?
beautiful. Beautiful. Thank you so, so much. One can really feel that this comes from your heart, Dr. Lily. Thank you.
Thank
Thank you
you.
for sharing this with our listeners. It's so true what you're saying. Thank you.
Thanks a lot, Tanya. It was lovely to talk to you.
Absolutely enjoyed it. I take away, the heart that you put into your session, the time that you take with your patients, to really be the sparring partner, no matter what they are facing on their journey. So thank you, Dr. Lily, for your amazing work that you are doing to all our Singaporean-based couples, as well as those that travel to Singapore to see you. This is amazing to know that there is someone like you here that really um, has the heart in this. Yeah.
Thank you very much, Tanya. It's lovely. It's so nice for you to say that. Thank you. Thank you.
Thank you. Thank
Appreciate that.
you. Yes, and we shall follow up on more topics, actually.
Sure, lovely to talk to
I
you.
could go forever with you.
We could go forever.
Thank you so much for your time
Okay, thanks
today,
for your
Dr.
time.
Lily.
Take
Thank
care. See
you.
you.
Take care.
Take
See
care.
you.
Bye-bye.
Oh, wow. What a conversation just now with Dr. Lily. Oh my God. Dr. Lily is such an amazing doctor with so much heart and with so much care for her patients, really. And I really loved how she is taking the time to meet them up. And she even takes like a full 1 hour in their first meeting to walk them through for their IVF and prepare them and really dive into it to see like what's stressing you out and what are the things that can help you. And beside that, also her knowledge about PCOS and how to deal with it, but also covering not only IVF, but also natural fertility treatment, as well as IUI, and then eventually IVF. It sounds to me that she is just the doctor you want to see. So if you have more questions or ask yourself, can I find Dr. Lily? Again, Dr. Lily Ko is one of the fertility specialists at Alpha IVF Centers in Singapore. You can find all the information in our show notes in the post beyond here. And I can't wait to get her back on one of my podcasts again, because we didn't even discuss other areas she's covering. So be tuned. And if you found this helpful and insightful today, please share with your friends. Maybe that's just what they needed to hear, that there is hope even in moments where everything feels not going into the right direction, but there is for sure available resources. And that's what Dr. Lily said as well. Please remind yourself, you are not alone. There is plenty of help here, specialists, people that really care about your fertility journey. So never give up. Please stay tuned and come back or get in touch with us if you want to explore more options. Thank you for listening and taking your time today, and see you next week. Can't wait to see you again. Thank you for joining me on this episode of the Fertility Counselor podcast. Remember, you are not alone on this journey. If you need support or have any questions, reach out to us via email at inquiries@counselingconnects.com. Don't forget to follow us on social media at Fertility Connects. We'd love to hear from you. If you want to learn more about us and the services we offer, head to www.fertilityconnects.com. And if you're looking for support beyond fertility, visit www.counselingconnects.com. Take care, and we'll see you in the next episode.